these things are nothing to mess around with. It's something that you want to get treated and then have really good follow-up, because they can affect virtually every part of your life, and they can mess you up for a long time if you're not careful. Hello, everyone. This is a new position and posture for me to be speaking with you today. And normally, if you've been tuning into the Ramos Law Difference Makers podcast, or you've followed us in the past on health matters, things like that, oftentimes you might see me with a guest, especially on the podcast, where we're talking about someone making a difference in the community or in their world. Well, we've decided that we want to take a little bit different approach to things and kind of mix it up, because variety is the spice of life, right? So what we decided to do was to do what we call a deep dive. And so today is the introductory episode of our deep dive segments that we'll be throwing out oftentimes, or at least intermittently, between our Ramos Law Difference Makers podcast. You can see us on YouTube or follow us on the podcast channels, that kind of thing. And in these particular episodes, what we're going to do is we're going to go deeper into singular topics. So for example, today we're going to talk about basically spine and head trauma and what happens, what to do, things like that. So we're going to go into that. In future episodes, you might see us having these conversations with someone who's a specialty in a certain area. And so it's going to be a really wide, varied, and very cool part of what we're doing. So that's what we're doing. We're starting that today. I'm super excited about it, and I want your feedback. So if you like this, or there's topics that you'd like to hear about, please let us know. You can email me, Jim, Jim, at Ramoslaw, RAMOSLAW.com, Jim at Ramoslaw.com, and we'll be able to accommodate some of the requests that you have. So today we're going to start this out, this deep dive segment, by looking at what happens to your brain, your spine, and your soft tissues after trauma. That could be a car accident. It could be a slip and fall. It could be any number of things, sports injury. All these things can cause these traumatic injuries. And so what I was hoping to do today is just to give you the basics, the highlight, and then start diving just a little bit deeper. Because as I just mentioned, some of this stuff you can see through our Health Matters pieces that we've done over the last couple of years, but they're all in very small segments. So we're going to go deeper, and depending on your response, your engagement, what you like, we might even drill deeper and deeper and deeper. So we just want this to be of value for you. So without saying any more about what we're going to do, let's get into it. When I was a practicing chiropractor, so I graduated chiropractic school in 1991. So it's been over 30 years that I have had the opportunity to work with people who have been in traumatic accidents. And so throughout that time, it was really crazy for me to see the way that these things affected people's lives, right? Like if you have someone who they have a great job, they're well educated, they have a great family life, everything in their world should be good. And all of a sudden they get in a car crash, let's say, or they hit their head on the ground on a slip and fall on ice, or something falls onto their head, or they blow out a disc. Any number of things can happen that now turns that person's life upside down. If you've ever met anyone or know anyone who's gone through this, you know exactly what I'm talking about. And God forbid you've gone through this yourself, because if you have, you know that not everybody understands. They don't feel your pain. They don't understand what you're going through, because it's just so wild. 1 minute you're this person, the next minute, and sometimes for months, or God forbid, even years afterwards, you're not the same person. And there's reasons for that. So some of the reasons that you can change almost personality from going through something like this is internally in your brain. Your brain is surrounded by the skull. That's meant to protect it. But when it goes through a whipping motion where it goes in and out into the base of the skull, or into the skull covering, your protector, when that brain bounces around in there, if it hurts certain areas, causes bruising or causes irritation, then that's going to affect the way all the neurology, all the chemistry, everything in that part of the head works. And every part of the brain controls something different and specific. And so when you do damage to a part of the brain, it shows up in a certain physical expression. So if someone notices that they are really irritable after one of these incidents, or if they can't remember, they have brain fog, they're not sleeping well, they are very nervous in social settings where they weren't before, oftentimes that's because of a brain injury. It could be a mild traumatic brain injury, also known as an MTBI, or it could be, and part of that, by the way, is concussion, or it could be something more major. And typically, if it's more major than that, they've been diagnosed in a hospital setting with a CT or something, where certain procedures have to be done up to and including surgery to let pressure off the brain, as in the case of really bad accidents, that kind of thing. But if you notice that when it comes to brain injury, whether it's mild/concussion or some of these major ones, it affects everything in your life. And we've already talked about why that is, because the brain is very sensitive tissue, and when it gets damaged, it affects neurons. But if you've never experienced it, it might be subtle for you to see someone at a different operating level. And that person may not even realize that they are having an issue. They might just say, "What are you talking about? I'm just agitated today," but you see it every day. So for those of you who might be watching that are a support system for someone who's gone through a trauma, especially if they haven't gotten any treatment, if they've been through some sort of an accident and they just say, "Oh, you know what? That just kind of, I got my bell rung here and I'm okay." And all of a sudden you're noticing little things that are different from before. It's really important that you let them know in a very kind way that you've noticed something being different, and that it would be a good idea for them to get checked out by a qualified professional. So when it comes to these concussion brain injuries, other symptoms that you could find are, besides the things we talked about, which again is sleep disturbance, irritability, agitation, headache. It can also be if you have a sensitivity to light or sound, things like that, that normally you were okay, but now these things really bug you. Those are all signs of concussive-based symptoms, and they're nothing to mess around with. Especially remember this, when it comes to concussion, when it comes to issues of your brain, they're cumulative. So in other words, if you get one of these through a traumatic incident, and then something else were to happen, a different slip and fall, or if you're in a contact sport, let's say you've been in a car crash and you're also a soccer player, and now when you're playing soccer, you're heading the ball, that can create a whole bunch of damage if that concussion hasn't already been handled and completely resolved before you take another head blow. So if you take a blow to the head from any number of different ways, that will then be cumulative, so that now your head injury becomes worse, more complicated, more difficult to treat, and frankly, more difficult to heal. So paying attention to what your body is feeling with a history, getting appropriate medical attention, super, super critical. Now, always, if you've been in a situation like this, again, whether it be a car crash or a slip and fall or a sports injury or a work injury where your head is involved, some injuries you want to just try to manage at home. Others, you want to go to the doctor first and then manage at home later. If you have a significant blow to the head, I always recommend first stage is going to a qualified professional, a medical doctor, a chiropractor, physical therapist. All these teams work together, even acupuncturists to help with pain, those kinds of things. It's typically a team-based approach that's going to get the best results possible for your head, your brain, and kind of the mental, emotional aspect of your healing to really take full form. Because here's the thing, if you don't get any treatment, you're going to notice that most of your benefit is going to come in the first 6 to 8 months of healing, and whatever doesn't get treated and resolved through there can kind of linger. And if it's a bad enough initial injury, it can become permanent. And none of us wants to experience that. We don't want that for any of our friends, family, or loved ones. So if you've had even a moderate accident where your head was hit, you want to get that checked out. So who are the specialists that check these out? Again, we gave you some of the baseline folks, whether it be your MD, your chiropractor, those would be an initial level. And then depending on what is found there, it may be necessary for you to get an MRI of your brain to make sure that there's no bleeding, make sure that there's no damage in there that needs further attention, or at least to see the scope of damage that's taken place. And if necessary, if conservative care and time isn't the healing factor that you need, then it would be moved up to where you might see a neurologist, even a neuropsychologist. And the neurologist is going to be checking how the brain is functioning from the inside to the outside. In other words, how is your speech? How is your sleep? How is your driving? How is your anxiety? all of those things with a traumatic brain injury that wouldn't necessarily be treated by the medical doctor and the chiropractor, because now that we've screened through that initial and determined, ooh, this could be a serious head injury, now we need specialist treatment. So that's where we would go then to our neurologist or neuropsychologist, any of these kind of people. Now, there are some really, really interesting alternative therapies that are out there that some of them have more scientific evidence or validation than others. Some of them have a lot of what we'll call anecdotal evidence or stories of people getting great results. And so there are things like hyperbaric oxygen therapy that after concussion, some people swear by. The literature hasn't borne that out that it's been uber effective, but the number and type of studies that are out there on it are not yet complete. And so in that sense, it might be worth a try as long as it's not cost prohibitive for you and it's not time prohibitive, because with oxygen therapy, it's going to be roughly an hour a day. And it might be, depending on how significant your injury is, the person who's recommending the therapy might say, you need to come in for this every day for 5 days or 10 days and then start spreading it out. So if you have the financial ability and means and you have the time availability, that could be a good thing for you to do. There's some different techniques that people are using by manipulating sutures of the skull that seem to be helpful. They call it cranial manipulation. That seems to be helpful for some level of concussion / MTBI. But then there's also, on the other side of the coin, this business of medication where neurologists might use things like gabapentin or other items in order to help with pain and or some of the other symptoms that are affecting you from a concussion or a TBI. So again, these things are nothing to mess around with. It's something that you want to get treated and then have really good follow-up, because they can affect virtually every part of your life and they can mess you up for a long time if you're not careful. So that's the intermediate deep dive for concussion. So without going too much deeper, let's move on to the next one, which would be spine. So oftentimes from some sort of a traumatic event, the spine becomes damaged. And you've seen me many, many times, if you've followed us at all, holding a model of a spine. There's 24 segments, 24 bones that divide out in the following way. There's 7 in the neck, there's 12 in the mid back, and there's 5 in the low back. And so when you add those together, then you've got a tailbone below that. And all of these bones sit on top of each other in a very specific way, where if you're looking at a spine the way I'm looking at you right now from the front, it's going to be straight. But if I were to turn that spine to the side and you'd be looking at it from the side, it would be, if the base of your skull was right here, the spine would curve to the front in your neck, and then it would curve to the back in your mid back, and then it would curve again to the front in your low back, so that it forms an S-type shape. And the reason that it does that is so that we have like a shock absorption as the spine is in motion, because in between each of those vertebrae is a disc. And that disc is a soft, yet kind of think of it like a rubber type substance. So it's not bone like the vertebra is. It's more like a washer that would be in a skateboard. If you see skateboards, how they have those rubber kind of grommety washer things, it's more like that. But this thing has nerve supply that goes to it. It has blood vessels that goes to it. And in the middle of the disc, there's a thing called a nucleus. And this nucleus is like a ball of jelly. So the whole thing rests and moves on that disc. And then in the back of the spine are these joints. They're called facet joints. And if you think of them, they're the guiding of movement of any two vertebra. So in other words, from the bottom vertebra to the top vertebra, they have these joints that come back where the top one connects to the second one connects to the third one, and all the way down the spine. And together, there's a concert of motion that happens. Well, guess what? There are literally 9 planes of motion that each and every one of those joints on the left and on the right can go through. So if you have an accident where you slip and you fall, or you get hit from behind in a car accident, or T-boned, or you fall off your bike, or you have a workplace injury where something falls on your head, or you lift wrong and hurt your back, any number of things could happen that can affect that spine. Now, here's the thing. No, your spine is super durable, but some of the structures within the spine are very fragile. For example, the nerves are kind of like well-cooked pasta. So if you have these nerves, if there's any pressure on them from swelling and irritation from a trauma, you know how when you sprain an ankle, that ankle balloons up and swells up? Well, that same thing can happen in and around any joint. So if you sprain the joints in your spine, called those facet joints once again, if there's swelling that comes around there and that starts getting right in the area where the nerve leaves the spine and starts going out to various parts of the body, then that nerve can get impinged, because remember, like well-cooked pasta. So that can send signals of pain, numbness, tingling to whatever path that nerve follows. For example, if I have an injury in my neck and there becomes swelling, irritation, and damage in that area to the nerve, then when the nerve comes out of my neck, in the lower neck, it goes down my arm and it can go into my hand. So I could have a nerve problem at my neck that results with pain, numbness, and tingling into my hand. So if we have that happen, what's the solution? Well, this is where some of our conservative care can be really, really good. Just because you have an injury in the neck doesn't mean that neck needs surgery. The first place I always, after treating thousands and thousands of patients as a chiropractor, I always wanted to make sure that I started with the conservative and worked my way out. So I had great relationships with medical doctors who were primary care docs and with specialists, people like orthopedists and neurologists, et cetera, et cetera. So if someone came in and after an evaluation, I was able to see that from all indications, whether it be from my physical exam, my range of motion testing, my orthopedic testing, x-rays that I might have taken, and any images that I may have gotten from the person had they gone to the emergency room or the urgent care or whatever, when I would be able to put all of that information together, I could usually tell if it was good to start a patient on a conservative care plan. And that conservative care plan, in my case as a chiropractor, would include a mobilization of the spine called an adjustment, which, as we talked about just a little bit earlier, you may remember that I talked about these joints that come off of the back of the vertebra. So if off the back of our fifth cervical vertebra, there's a joint coming back, two pieces of bone, then there's from the next lower cervical vertebra, that one comes up. There's an extension of bone that comes up and they meet together. And that forms the joint between that, what's called a vertebromotor unit. So between two segments. So now there's 9 planes of motions that each of those joints can take on the vertebra, left and right. So if that thing undergoes trauma, now there's a whole bunch of ways that the spine can have incorrect movement or immobility. That then creates issue, trauma to the tissue, just like a sprained ankle. You can have a sprained spinal joint. That causes inflammation and irritation. That also causes a really big stress message to go to the brain. And if the brain gets a stress message coming into it, you know what it does? It sends a stress response message back out to the body to tell it what to do given the circumstances it finds itself in. Now, for example, if you sprain your neck, or again, we talk about sprained ankle, swelling, discoloration, all that kind of stuff. If you sprain the joints in your neck, now you're going to have decreased range of motion. You're going to have increased levels of pain. You're going to have decreased ability to move any part of your body. You might notice that you have especially if it's a newer injury, that it's more of a sharp pain. It can be deep, but still sharp and kind of stabbing. Whereas if it's been there for a while, it might be more of a chronic, dull ache type of sensation that was caused from some sort of traumatic injury. Now, if I, as the chiropractor, start looking at this, I'm going to say, okay, can I move this in a way that's going to open up or release that joint dysfunction? So oftentimes by taking that spine and adjusting it, I restore motion back into that joint, allowing it to move normally. You know what that does? Remember how I said earlier that there's a stress message from an improperly moving joint that goes to the brain? Brain sends back a stress response. Well, if I release the stress in the joint, I open the joint's moving better. Now the joint goes, oh, okay, everything's cool out here. So it sends a message back up to the brain that says, hey, things are better. The brain sends back down a message to the body that says, ooh, I don't need to protect you by putting you in pain, because that's what pain is, right? When you get pain, it's your brain's way of telling your body, don't do that. And by not doing that, you're alleviating stress, you're making the body have to work less, and it just makes it feel better. So we're literally hacking the brain when we do things like adjusting, soft tissue work, special taping called kinesiology taping. All of these things are meant to drive information up to the brain. The brain processes it and says, oh, okay, I see that things are okay out there. And then it sends back a message that gives a more appropriate response to pain relief, increased range of motion, increased stability, all of these things, because the brain is no longer feeling under threat. Now, that's in a best case scenario as far as treatment goes. There's also home treatments that we can do for things like sprains and strains. And the home treatment would be icing, especially after an injury, when an injury is acute or right after it's happened. See, what happens then is you get irritation and some tearing of some of the soft tissues, the joints irritated like we've talked about, there can be swelling, and by putting ice on that area, I recommend putting it on for about 10 minutes of when you feel it cold. Like if you just put it on and you have a shirt on and you put that on over your shirt, it may take you 2 or 3 minutes before you feel any cold at all. So I always like to have that cold feeling for at least 10 minutes. But if it starts to feel numb, that's too long. Because what we don't want to do is create any kind of thermal damage to the skin, frostbite, frost nip, any of that kind of thing. So I like to recommend that patients, they ice themselves. Now, the providers that we work with here at Ramos Law, they're all top shelf, and they do an incredible job of treating trauma-based injuries, because it's a different thing. A trauma injury is different than just a neck ache. And so we have to be able to differentiate that. And the providers that we work with are really, really, really excellent at that. But if you're at home, something's happened before you can get into the provider, or it was a very mild situation, you're like, oh, no big deal, let's see how my body heals it, then I always like to start with ice. And I like to start also with, when we're talking about spine, with getting as much pain-free range of motion in as possible. And just as an example of this, if someone has a neck issue we're talking about the neck, I would want them to move their head like I'm doing right here in a pain-free range of motion for a lot of reps, like 50 reps, where they're just going like this or going like this or going like this, just a very small range of motion, as that will allow the body to actually get blood flow to the area. It will stimulate neurologically so that the body can heal. And then as time goes on, then increase the range of motion. And eventually you could even do some resistance where you're pushing into something to strengthen muscles. And so those are all at-home basics that you can do. And we would have to go into a really deep dive to give you a lot of specific exercises for each part of the spine. But just for now, think that there's bones, ligaments, and joints that surround the spine. When the body goes under trauma, the bone likely won't get hurt unless there's a fracture. If there's a very significant trauma from like a seatbelt getting whipped over in a car accident, that can cause what's called a lap belt fracture in the lumbar spine. If we fall or we have a significant trauma in the neck, it can cause fractures in what's called the pedicles, which are part of that joint complex we talked about. It can also cause what's called a clay shoveler's fracture, where the ligament pulls the back of the spinous process off. And the spinous processes are the bumps that you can feel if you put your hand on your back. They're the kind of knobby things. You can actually pull that off. So there can be different kinds of fractures. Fractures can be stable or unstable. So there's a lot to spinal injuries. And so if there's any doubt, or if especially if you were involved in a car crash where you have massive forces, even at low speeds, like a 10 mile an hour crash where someone runs into the back of someone else at 10 miles an hour, the force going through that car is the weight and the speed of one car times the weight and the speed of another. So if one is stopped and the other one's only going 10, but it weighs 4,000 pounds, that's a lot of pressure going through that. And a neck with an 8-pound bowling ball on the top on these tiny little vertebrae getting whipped back and forth, called cervical deceleration injury, also known as whiplash. It can cause a lot of damage by spraining those ligaments, stretching those ligaments, and or giving some degree of tear there, and also causing strain to the muscles around those joints. All of this is problematic and can result in long-term or even permanent injury if it's not rehabbed correctly. And like we talked about earlier, very, very easily done a lot of times with conservative management, with chiropractic, physical therapy, massage, acupuncture, sometimes medication when needed just to help control the pain. But if the ligament damage is too bad, or if the disc now, instead of, remember I talked earlier about the kind of bushing thing on the outside and then the disc on the inside, if that bushing thing called an annulus tears all the way through, allows that ball of jelly to squirt out into where the nerves live, whether it be the spinal cord running right down the back of the vertebra or one of the spinal nerves that exits the spinal cord off to the left and right, then we have problems. And that can lead to more aggressive therapy up to and including surgery to fix that. So we really have to be thoughtful on how we manage these injuries. Now, the last section I want to deep dive into today is the soft tissues on the outside, so away from necessarily right on the vertebra. So if we're looking at spine, there are a group of muscles called the paraspinals. They go from the pelvis all the way up to the neck, and they're like lines of cables that go all the way down. Then there's a group of muscles called the suboccipitals that attach from the lower neck onto the skull. There's the pec muscles that come across and attach onto the shoulders. All of these things play a role in what happens after a traumatic injury because they're all supporting the neck and the spine. The muscles that attach to the shoulder blades, the scapula, also have an impact on how we move. So after any kind of traumatic injury, it's always a good idea to make sure that those muscles are rehabbed. If you tear a muscle tear called a strain, mostly they're grade 1 or grade 2, so that now that muscle is damaged, it's swollen, it's hurting, there's limited range of motion. What we have to do there is we have to calm that down. Same thing would apply, right? Getting ice, getting lack of mobility, pain-free range of motion. But over time, when it starts to heal, then we need to strengthen those muscles. Get them strong so that they can now support the joints that they're there to protect, so that they allow us, through good strength and flexibility, they allow us to gain back full range of motion, because it's the normal range of motion that is sending the input in through those joints that we talked about earlier up to the brain. If we have normal range of motion, the spine gets a normal input and it sends back a normal response that everything's cool, make it happen. But if we have damage in our muscles and in our joints, then the brain's getting a stress message, and it sends down a stress response of don't move right like you should, because you got to protect yourself. Let's send some pain or stiffness down into these areas so that we know not to hurt ourselves, because if we do that, that hurts and that would hurt us. So if we do that, let's stop that. So it'll send pain. All of these things are right there for us to take care of if we're paying attention. So I hope that's given you some of the basics at a deeper level of things that we may have talked about in 1 to 3 or 4 minute segments before. But again, I know we're just touching the surface on this. So I had a great time sharing some of this information with you. I hope you enjoyed it. I would love your feedback on it, since this is our first one, and thoughts on how we could go deeper, if there's questions that you have, or if you would like to talk about different topics. But again, thank you so much for being part of the Ramos Law community. It makes such a difference knowing that you guys are learning from this and that we're able to help you in whatever way we can. It's not just about representing you for a case. It's about giving you information that brings you value in your everyday life. So please reach out to me, Jim@ramoslaw.com, with thoughts, with comments, with other ideas, and we will look forward to talking with you next time.